Just a nurse. That was what Dr. Marcus Caldwell called her in the break room, voice dripping with the kind of condescension that made other staff members suddenly very interested in their lukewarm coffee. It was 6:11 a.m. on a Tuesday when Brooke Sullivan arrived at Seattle General Hospital in Portland, and she had been just a nurse for exactly 18 months, ever since the moment she made the mistake of being right at the wrong time. The fluorescent lights hummed their mechanical hymn overhead as she moved through the ICU corridors with the kind of practiced invisibility that comes from knowing exactly how to occupy space without being seen. Her scrubs were crisp, hospital-issue blue, and she had pressed them the night before with the precision of someone who understood that discipline lives in details. Her name badge hung 2 inches below her collar, clipped at a perfect angle. She carried a trauma shears in her right pocket, the metal worn smooth from handling, and in her left jacket pocket, folded against her ribs like a second heartbeat, was something she could never let anyone see. The ICU was quiet at this hour, that rare pocket of time before the day's shift erupted into controlled chaos. Brooke moved from bed to bed with movements so efficient they looked effortless. She checked vitals on Mr. Hendricks in Bay 4, her fingers finding his radial pulse in 4 seconds flat, her eyes reading the monitors with the speed of someone trained to extract meaning from numbers in a single glance. Heart rate 82, sinus rhythm, oxygen saturation holding at 96%. She made a note on the chart and moved to the next patient without hesitation, without the small talk that other nurses filled silence with. A resident named Dr. Chen watched her work. He was new enough to still notice things, still young enough not to have learned which observations to keep to himself. He watched her hands, small, methodical hands, and he saw the white scars that crossed her knuckles in precise diagonal lines. He saw the burn mark on her left wrist, old enough to be pale but structured in a way that didn't look accidental. He saw her move like someone counting steps, someone measuring distances, someone who understood that efficiency saves lives. He started to ask her something, thought better of it, and turned away. The break room at 6:52 a.m. was nearly empty. Brooke poured black coffee into a ceramic mug that had been there since someone's rotating schedule ended 3 weeks ago, and nobody had claimed it. The smell of burnt coffee hung in the air like a residue, mixing with the antiseptic tang that never quite left the hospital no matter how many windows you opened. She stood at the window facing the parking lot, watching rain hammer the asphalt in patterns that looked almost like Morse code. Her left hand reached up, found the inside of her jacket, and touched the small bulge where fabric met fabric. The faded SEAL Team 3 patch was still there, sewn inside the lining where it had lived for 18 months, pressed against her ribs like a classified secret written in thread. She heard him before she saw him. Dr. Marcus Caldwell entered the break room with the kind of presence that made oxygen molecules rearrange themselves. His white coat was immaculate, tailored in a way that suggested someone else paid his dry cleaning bills. His smile when he acknowledged the one other nurse in the room was the kind of smile that looked like a wolf showing its teeth. Brooke didn't turn from the window. She sipped her coffee with both hands holding the mug, a deliberate gesture of calm that required more discipline than anyone watching would ever understand. "Good morning," Dr. Caldwell said, his voice like a tank idling in a garage, all dormant power and implied threat. She turned, met his eyes exactly once, held the gaze for exactly 2 seconds, and nodded. Said nothing. The other nurse in the room suddenly found the refrigerator fascinating. What he didn't see, standing there in his tailored coat with his unblemished hands, was the history written into the white scars across her knuckles. Those came from San Jin, from field hospitals where the electricity failed at 2 a.m. and she had to see by a red lens flashlight while holding combat knives across charred skin. What he didn't see was the tremor in her hands, and yes, there was a tremor, but not the kind that came from fear. That tremor came from restraint, from hands trained to move at lethal speed learning how to move at civilian pace. What he didn't see was that she had already killed a man with the skills she was hiding behind polite nods in a hospital break room. He smiled, satisfied with her silence, and reached for the coffee pot. 18 months earlier, Brooke had made a single mistake. She had been excellent at her job in front of the wrong witness. Dr. Caldwell had been reviewing post-operative protocols on a patient, a 64-year-old man with triple bypass grafts who was running a fever and showing signs of fluid accumulation. Caldwell had written the order for a standard antibiotic protocol. Brooke, standing beside a surgical resident named Dr. Sarah Wu, had said 3 words, "That's the wrong one." She had said it quietly. She had said it with respect. She had said it with the kind of certainty that only came from someone who had run the numbers, checked the renal function, cross-referenced the drug interactions, and understood that the patient was displaying signs of early sepsis from a fungal infection, not bacterial. The antibiotic he had prescribed would have delayed treatment by 36 hours. Dr. Wu looked at Caldwell. Caldwell looked at Brooke. And Brooke, in that moment, watched something shift in his expression. Not anger, not yet. Just recognition. Recognition that a nurse had corrected him. That a nurse had been right. That a nurse had done it in front of someone junior to him who had heard the correction and would remember it. The patient recovered perfectly. Caldwell never forgot. 6 months into his vendetta, he had learned that Brooke folded her scrubs with precision before each shift, arranging them in her locker in colors that somehow created order from the chaos of supply rotation. He had watched her hands do this work, and he had noticed something he shouldn't have noticed. When he walked past, her hands trembled. Just slightly. Just enough for a predator to recognize a nervous prey animal. What he didn't understand was that the tremor wasn't fear. It was the muscle memory of a woman trained in unarmed combat, hand-to-hand techniques classified enough that her service record had been erased from every database that didn't require a presidential briefing. When her hands trembled, she was controlling the impulse to move at speeds that would break bones. The tremor was what discipline looked like from the outside. The break room felt smaller after he poured his coffee and left, nodding at the other nurse on his way out. Brooke remained at the window, watching the rain. She thought about the patch inside her jacket, the one that proved she had ever existed in the world as anything other than just a nurse. SEAL Team 3. Charlie Platoon. Embedded with combat operations in Helmand Province for 18 months as a surgical officer. 47 field surgeries. 6 soldiers whose blood had soaked through her gloves and who had walked out alive because her hands knew things that no civilian trauma surgeon could learn in a classroom. All of that was gone. Officially, she had never served. Officially, her records had been sealed and expunged after what they called an extraction gone sideways in Sanjin, an operation the government still refused to acknowledge, a mission that had gotten 3 soldiers killed and 1 town erased from official reports. They had told her to disappear. They had told her to become someone new. They had told her never to surface again because officially, Major Brooke Sullivan did not exist. So she had become a nurse. She had folded her scrubs with precision and carried her trauma shears in her pocket and sewn her unit patch inside her jacket lining like a prayer written in thread. She had learned how to be invisible in hospitals because she was already invisible everywhere else. The government had been very clear about the terms: take your burial benefits, take your new social security number, take your new name, take the apartment they arranged, and disappear. Tell no one. Show nothing. Be no one. Dr. Caldwell had made it his mission to ensure she became even less than that. The shift began at 7 a.m., and Brooke clocked in with a badge swipe that logged her presence in a system that had no record of her military service, no record of her rank, no record of anything that mattered. She returned to the ICU and found Dr. Caldwell already there, moving through the unit with his white coat fluttering behind him like a cape. The surgical resident, Dr. Wu, was presenting a case, a patient in Bay 2 who had developed complications post-surgery. The labs show elevated lactate and a left shift in the white count, Dr. Wu was saying, pointing at the monitor. I think we should follow protocol, Dr. Caldwell interrupted, his voice sharp enough to cut. He turned, and his gaze landed on Brooke, who was updating charts at the nursing station 3 beds away. Nurse Sullivan, come here. You were the one monitoring this patient last night. Tell Dr. Wu what you observed. This was stage 1 of his campaign: put her on display and then dismantle her publicly. Brooke set down her pen, crossed the distance in measured steps, and arrived at the bedside just as Caldwell stepped directly into her line of sight to the monitor. The patient's temperature climbed to 101.8 at 3 a.m., she said, her voice steady. I recorded a slight distension in the abdomen and noted pain response when palpating the surgical site. The drain output increased to 120 milliliters between midnight and 3 a.m. She had delivered the information with complete clinical accuracy. She had been methodical, precise, thorough. Any surgeon in the room should have heard in her words the experience of someone who had run diagnostics under far worse conditions than a modern ICU. Dr. Caldwell smiled. His smile was the kind that looked like a predator recognizing weakness. Interesting. Fascinating, even. But what I heard was speculation and assumption. This patient is presenting with post-operative swelling, entirely normal. The drain output is within parameters. And the temperature spike is consistent with the body's natural inflammatory response to surgery. He turned to Dr. Wu. What I want from the nursing staff is accurate vital sign documentation, not interpretation. Leave the diagnosis to the physicians. You understand, Nurse Sullivan. Brooke was aware that the ICU had gone quiet. She was aware that 2 other nurses had stopped what they were doing and were suddenly very interested in their keyboards. She was aware that Dr. Chen, the resident, was staring at his shoes with the intensity of someone watching a car accident. She was aware that her hands were trembling. She met Dr. Caldwell's eyes. She held the gaze for exactly 3 seconds. And then she said, "Yes, doctor," in a voice that sounded like it belonged to someone who had never held a weapon, never commanded soldiers, never saved lives that mattered, never been major anything at all. He nodded, satisfied. He walked away. The ICU resumed its careful silence. Brooke returned to the nursing station and updated the chart with information that would prove her right when this patient's condition worsened. She had seen this pattern before, in field hospitals in Sanjin where the electricity went out and the only light came from muzzle flashes illuminating the surgical field. She knew what was coming. She knew this patient had hours at most before sepsis became obvious, before Caldwell's protocol proved catastrophically inadequate, before someone had to make a decision that would either save a life or end it. She touched the patch inside her jacket again, a reflex, a prayer, a promise to someone, herself or the uniform or the soldiers she had buried in the sand. The day was just beginning. 3 hours from now, everything would change. The doors to room for 12 were already open when Brooke arrived, her chart tucked under her arm like armor. She could hear Dr. Caldwell's voice before she could see him, that particular cadence he used with families, warm and paternal, the voice of someone who had nothing to hide because the world told him he was right. The Ramirez family sat clustered around the bed, mother in the visitor's chair, daughter standing near the window, father's hand wrapped in gauze from the fore placement. Mr. Ramirez's post-op labs were supposed to be routine. Brooke had memorized them 30 minutes ago. Creatinine elevated. Urine output down 22% since surgery. The medication Caldwell was explaining, a diuretic increase, would compound both problems. She stepped into the room quietly. Caldwell didn't look up, just continued speaking as if she were part of the wall. "We're simply adjusting your fluid management to ensure optimal cardiac output," he said, his hand making the gesture of casual certainty. "The dosage increase is well within standard parameters for a man of your size." Brooke's eyes moved across the chart in his hands. The numbers were wrong. Not slightly wrong. Dangerously wrong. She'd done the math twice. The dose he was about to administer exceeded safe limits for kidney function by nearly 40%, and Caldwell had the lab values right there in front of him. He simply hadn't looked closely enough. Which meant he didn't intend to look closely. Which meant it didn't matter to him if he got it wrong. She took a breath that tasted like the antiseptic that clung to everything in this building. "Dr. Caldwell, that dosage exceeds the safe range for his kidney function." The room changed. Not visibly, the walls didn't move, the lights didn't flicker, but something in the air pressure shifted, like the moment before a storm breaks. Caldwell's hand froze. His smile remained in place, but his eyes went flat. He turned to face her with the kind of deliberate slowness that was somehow more threatening than any sudden movement could have been. "Nurse Sullivan," he said, and the warmth in his voice had curdled into something with edges. "Or should I call you Dr. Sullivan?" His eyes glinted with the pleasure of the setup. "Oh, I'm sorry. You're not a doctor." The daughter looked down at her hands. Her mother shifted in the chair, suddenly very interested in a spot on the floor. The father's grip on his bandaged hand tightened, his eyes moving between Caldwell and Brooke like he was watching a tennis match where the stakes were his own care. Caldwell stepped closer, angling his body so that his silhouette blocked the light from the window. His voice dropped to the register of reasonable disappointment. "When you complete medical school, you can question my orders. Until then, stay in your lane." He paused, letting the words settle. "I've been practicing medicine for 23 years. I think I understand dosage calculations." Brooke's hands were steady at her sides. Her breathing was steady. Every muscle in her face was steady, and that steadiness was the only thing keeping her from breaking into pieces, because the steadiness was habit, and the habit came from rooms where people died when you flinched. She took one measured breath. A single tear escaped from the corner of her right eye, not from sadness, but from the pressure of swallowing down what she actually was, who she actually was, in front of a man who thought he knew exactly who she was and was wrong. She wiped it away without breaking eye contact. Without flinching. Without lowering her gaze even 1 degree. "The patient's labs will prove which of us is right," she said quietly. Caldwell's jaw tightened. For just a fraction of a second, something flickered across his face, uncertainty, maybe, or the first small crack in his certainty about how this conversation would go. Then he smoothed it away and turned back to the family with the practiced ease of someone moving on to more important matters. "I'll be back to check on you this evening, Mr. Ramirez," he said, as if Brooke had already left the room. She didn't leave. She approached the bed, checked the fall line with practiced hands, spoke directly to the patient in a voice that was professional and low. "We're going to monitor you very closely. If you feel any change, dizziness, shortness of breath, anything, you use this call button. I'm here." She didn't say whether Caldwell was or wasn't coming back. She didn't have to. The family understood the subtext now. They always did. The daughter was watching Brooke as she left. Their eyes met for 1 second, long enough for the girl to see that the nurse wasn't broken, just careful. That there was a difference. The break room the next morning was the kind of fluorescent-lit box that every hospital seemed to have, windowless and smelling like microwaved coffee and the faint ghost of someone's lunch from last week. Brooke sat at the corner table with her sandwich and her water bottle, the only items on the table in front of her. The room was empty when she arrived. Empty was fine. Empty was predictable. 3 nurses came in around 10:41 a.m. She recognized them: Tyler from nights, who borrowed pens and never returned them, Sarah from the surgical unit, who had smiled at Brooke in the hallway exactly twice, Marcus from ortho, who had nodded at her once during a hospital-wide meeting. They saw her at the same moment she saw them. Tyler's eyes went to the refrigerator. Sarah's hand froze at her locker door. Marcus was already turning, his jaw moving like he was about to say something, before he apparently decided against it. One of them whispered. Brooke didn't catch the words. She didn't need to. She'd been 16 years old once, surrounded by soldiers who were deciding whether she could survive with them. She'd learned this language then. This was the language of the pack determining whether it was safe to eat near the wounded one. Whether the wounded one might bite, or whether the wounded one had already died and nobody had told it yet. They grabbed their food. They didn't look at the empty chair across from Brooke. They left through the door they'd come in, and the silence they left behind was so thick it had weight. It pressed down on the corner table like gravity. Brooke ate her sandwich slowly. The bread was dry. The turkey was cold. Her hand stayed steady around the fork, her swallows even and controlled, because showing that this bothered her would be like bleeding in a tank with sharks. But that wasn't the worst part. The nurse's station at 11:34 a.m. was busy, phones ringing, residents grabbing charts, the air moving with the organized chaos of a hospital mid-morning. Brooke was updating medication records when she felt Caldwell before she heard him. That same presence she'd felt in room for 12, the way the air pressure changed around certain people. He was holding something in his hand. A piece of paper. He walked to the unit board, the physical bulletin board where staffing schedules and patient announcements and department memos were posted for everyone to see, and he pinned the paper there with a kind of deliberate precision that suggested he wanted it to stay there forever, engraved into the permanent record. Brooke could read it from her position: policy violation, Nurse B. Sullivan. Insubordination. Questioning physician orders. Documentation provided. Signature: Dr. M. Caldwell, M.D., attending physician. He didn't post it quietly. He moved slowly, letting staff notice. 2 residents glanced over. A charge nurse paused mid-conversation. The document was typed, official-looking, the kind of thing that belonged in a file and not on a public board. Brooke understood the message. This wasn't about the rules. This was about erasure. This was about making her invisible by making her name visible everywhere, stamped with shame. Caldwell turned and gestured to her. Nurse Sullivan. A word. She walked toward him the way she'd learned to walk toward authority in a dozen different uniforms. Straight spine. Eyes forward until she was close enough to meet his. The expression of someone listening. Not someone being accused. Never someone being cornered. I've documented every instance of your inability to respect the chain of command, Caldwell said, his voice pitched low enough that the residents couldn't quite hear, but loud enough that they could see his lips moving. My brother-in-law sits on the hospital board. He finds your pattern. He paused, choosing the word like he was selecting a scalpel. Concerning. His brother-in-law. Of course. Caldwell had allies. He had a family tree full of people in positions of authority, people who would take his side because his side was their side, people who believed that loyalty to blood was more important than the truth of dosage calculations or the value of a nurse who caught his mistakes before they killed someone. I understand, Doctor, Brooke said. You should, Caldwell said. He leaned closer, and his voice dropped to something almost intimate. You're invisible here, Nurse Nobody. I've made sure of that. Remember that. He turned and left, leaving her standing at the nurse's station while 3 different staff members found other places to be. Brooke absorbed the hit with one measured breath. Her hands didn't tremble. Her eyes didn't water. Her composure remained absolute because that was what she had left. That was the only thing between her and disappearing completely. She absorbed it the way she'd absorbed every hit for the past 18 months. The public corrections. The reassigned shifts. The way conversation stopped when she entered a room. The way her name had become shorthand for a problem instead of a person. Major Brooke Sullivan had walked through hostile territory with nothing but her hands and her training. She could walk through a hospital hallway. That evening, she was charting in the corner of the nurse's station when a voice came across the overhead system, calm and crisp: massive trauma incoming. ETA 12 minutes. Prepare Trauma Bay 3. All trauma staff to the ER. This is not a drill. The doors to Seattle General's emergency department burst open 13 minutes later with the kind of organized chaos that only came with life-or-death situations. The ambulance crew was running, not walking, their hands steadying the stretcher. The patient was coded as male, mid-30s, severe chest trauma from a training accident, massive internal bleeding, heart rate already in the low hundreds. The ER attending, Dr. Ewan, was in the trauma bay before the stretcher had fully stopped moving. A resident followed, already pulling on sterile gloves. 2 nurses took position at the patient's head and arms. Brooke stood in the doorway. She wasn't assigned to this trauma. Someone else's name was on the roster for Trauma Bay 3. But the pull of crisis was something she'd never been able to resist, and for a moment, just for a moment, she let herself watch. The patient's chest was exposed to the overhead lights, pale and bloated, clearly at wrong. His neck veins were distended like cables. His breath sounds were absent on one side, the left side, where trauma nurses could see the subtle wrong geometry of his ribs. His oxygen saturation, despite the mask over his face, was already in the low 80s. His blood pressure was dropping in real time, the monitor recording the steady descent, 85/50. 80/48. 78/45. Pericardial tamponade, Dr. Ewan said, staring at the ultrasound screen where blood was visibly compressing the heart in its sac. We need cardiothoracic surgery now. Get Chen on the phone. The resident was already dialing. He's in the operating room. Second case of the day. He says he can be here in 20. The resident's voice trailed off as the monitor alarmed again. The patient's blood pressure had bottomed, 60/40. Systolic dropping below safe threshold for cerebral perfusion. 20 minutes he'll be dead, Dr. Ewan said flatly. She stared at the chest, her hands moving through the motions of preparation but her eyes saying what everyone already knew. They were watching a man die in front of them, and the tools to stop it were 15 minutes away. Brooke's hands were moving before her mind had finished the calculation. She was already moving toward the crash cart, already reaching for the instrument tray, already stepping forward with the kind of certainty that came from having done this exact procedure in a place where hesitation meant funerals. Her voice when she spoke had changed, that single octave drop that came when civilian protocols stopped mattering and survival protocols took over. Step back, she said. Dr. Ewan turned, her eyes widening. Nurse Sullivan, you can't. But Brooke was already prepping the incision site, her fingers moving across the patient's exposed chest to find the anatomical landmarks. Fifth intercostal space. The space between the ribs that was just wide enough for a scalpel and a hand and a lifetime of training. She could feel the ribs beneath her fingers like a problem with a solution. She could see the anatomy the way she'd learned to see it in field hospitals where there was no time for doubt and no room for protocols that assumed anyone would survive long enough for surgery. Fifth intercostal, midclavicular line, she said, and it wasn't a question. She made the incision with one smooth motion, the scalpel sliding through skin and muscle and fascia with the kind of precision that only came from hands that had done this before. Not in a simulation. Not on a mannequin. In a place where the difference between this cut and the next cut meant the difference between going home and going into the ground. Blood welled up. She didn't hesitate. She positioned the rib spreader and cracked the ribs apart, the sound of it like breaking a branch, terrible and necessary. The resident gasped. Dr. Ewan was standing motionless, her hands frozen at the edge of the sterile field. Brooke could see the problem now. The pericardium was distended with blood, the heart compressed inside its own sac like a fist closing. She found the clamps and began working, her hands moving with muscle memory, her breathing controlled and even. Clamp here. Suture there. Find the laceration, close it before the heart stopped its final squeeze. The monitor was screaming at them, 45/30. The patient was seconds away from cardiac arrest. She felt the moment it changed. The moment her suture closed the tear in the cardiac wall. She released the clamp and stepped back, watching the blood drain from the compressed sac, watching the heart expand, watching the monitor climb back toward something resembling life. 80/50. 85/55. 90/60. The patient's color returned. His oxygen saturation climbed. His heart was beating on its own, no longer crushed, no longer drowning. She was closing the thoracotomy when she heard the footsteps. Dr. Marcus Caldwell walked into the trauma bay at 7:48 p.m., his eyes taking in the scene in front of him, Brooke with blood on her gloves, a Navy SEAL breathing on his own, a procedure that had been performed by someone who wasn't authorized to perform it, under someone else's patient, by someone he'd been working very hard to erase. The room went silent. Even the monitors seemed to quiet, as if the entire hospital had stopped breathing. Brooke's hands moved like muscle memory made flesh. 18 months of humiliation dissolved the moment the ultrasound probe touched the SEAL's chest and revealed what they all feared, blood flooding the pericardium. Cardiac tamponade. The heart drowning in its own sac. The ER attending, Dr. Reeves, stepped back. His face went the color of wet concrete. A resident named Thompson whispered, "Jesus Christ," and froze like he'd just realized he was watching someone die in real time. Brooke didn't ask permission. She didn't announce what she was doing. She didn't apologize to the paralyzed attending or explain to the watching residents why a nurse was moving a scalpel kit toward a trauma bay. She just moved. The same way she'd moved in Sanjin. The same way she'd moved in 3 other field hospitals where the choice wasn't between protocol and chaos, it was between action and body bags. The scalpel was German steel, razor sharp. She'd held blades like it 1,000 times. Her fingers remembered the weight. The balance. The angle of entry between the 4th and 5th ribs, the lateral edge of the sternum, the precise movement that takes you from skin to blood cavity in one clean stroke. No hesitation. No second guessing. Pain is information. Pain is data. She cracked his ribs. The sound was exactly what everyone feared, a wet snapping, like greenwood breaking, like something inside a living human being was being methodically dismantled. One of the residents turned away. Thompson stayed. His hands were shaking. Brooke's weren't. Hands that had held lives together in the dark. Hands that had worked by flashlight in FOB compounds while incoming mortars rattled the walls. Hands that could do this in their sleep. Blood. So much blood. The ventilator wheezed its mechanical rhythm as she worked, as if the machine itself was breathing in sympathy. The sac was distended, purple-black, taut as a water balloon 3 seconds before it ruptures. She made the second incision with a pericardiotomy knife, the blade angled precisely, and the fluid burst out like opened floodgates, dark blood and serosanguineous fluid, 30, 40, 50 milliliters pouring onto the blue surgical field. The pressure released. The heart could move again. She could see it. Could feel its rhythm reorganizing, desperate, gasping, searching for room to beat. Clamp. She reached out and Thompson actually moved. Handed her the instrument without being asked. He understood now. He'd stopped watching a nurse break protocol and started watching someone save a life. Muscle memory. That's what they'd call it later in the investigation, in the depositions, in the carefully worded files that would follow her like ghosts. But muscle memory wasn't something you learned from YouTube videos about nursing procedures. Muscle memory was Sanjin. It was 3 tours. It was 47 field surgeries with rounds cracking the night sky around you and understanding that bleeding out took minutes but steady hands took only seconds. The monitor showed what they all wanted to see, sinus rhythm. Actual rhythm. The heart wasn't just beating, it was organizing itself, finding its pattern, returning to something resembling order. O2 sat climbing. 68. 72. 80. Rising like an elevator leaving the basement. Stable. The word hung in the air like a prayer someone had finally answered. The door to the trauma bay opened at 8:33 p.m. Brooke knew the exact time because the wall clock had just clicked past the number. Dr. Caldwell stood in the doorway for exactly 3 seconds. She could feel him taking in the scene. Blood on her scrubs. Blood on her gloves up to the elbows. The SEAL's open chest. The resident standing silent. Thompson holding instruments like he'd just witnessed a resurrection and was still waiting for the explanation. The monitor beeping steadily, alive, defiant. Caldwell's face transformed. Not with shock. Not with gratitude that a SEAL was still breathing. His face transformed with the cold calculation of a man who'd just watched his authority severed by a nurse who dared to act without his permission. He didn't say anything. He turned and walked back out into the corridor. He'd be gone for exactly 4 minutes. Long enough to step into the stairwell. Long enough to pull out his phone. The first call went to administration. Brooke didn't hear it directly, but she'd see the documentation later, the timestamps that would become weapons. I need to report an unauthorized surgical procedure. A nurse. Yes, a registered nurse. Performed a thoracotomy without physician authorization. Yes, the patient survived, but that isn't the point. Protocol exists for a reason. We have liability exposure. Yes, I'll hold. The second call went to his brother-in-law, the hospital board member whose name would appear in 17 different conversations over the next 5 hours. Marcus, it's Richard. We have a problem. Seattle General has a staffing issue that needs immediate board attention. A nurse, completely out of scope, performed a procedure reserved for physicians. I don't care if the patient lived. That's not the precedent we set. What? No, I'm handling it. But I need documentation. I need her credentials flagged. Tonight. The third call was strategic. Risk management. The words that would matter most: we need a full investigation. Documentation of the unauthorized procedure. Chain of custody for the scalpel she used. Photographs of the patient's open chest cavity. I want everything recorded. This is going to be a malpractice defense case, and I want every detail protected under attorney-client privilege. No, I'm not overreacting. I'm protecting the hospital. Brooke didn't hear these calls. She was closing the chest, placing a temporary dressing over the thoracotomy site, securing the edges, moving with the efficiency of someone who'd sutured wounds while sand from the Helm and Valley clung to her gloves. She was thinking about whether the SEAL would need an ECMO machine in ICU, whether his lungs had taken fluid, whether his cardiac function would stabilize, or whether this was just the beginning of a longer spiral. She was thinking about everything except what was happening in the stairwell. By 9:03 p.m., an email had been sent to the nursing supervisor, Patricia Chen. Subject line: immediate credential review required. The message contained one sentence that changed everything: unauthorized surgical procedure performed by RN Sullivan outside scope of practice. Credential suspension effective immediately. Pending full investigation. Patricia found Brooke at 9:15 p.m. She was still in the trauma bay, still wearing the bloodstained scrubs, still checking vitals, still doing what she'd been trained to do since she was 23 years old and had signed papers making her disappear officially while simultaneously making her the most qualified person in 3 operational theaters. "You need to come with me," Patricia said. Her voice was very quiet. She wouldn't meet Brooke's eyes. 9 years they'd worked together. 9 years of Patricia borrowing her notes on difficult patients. 9 years of Brooke covering shifts without complaint. 9 years dissolved in the time it took Caldwell to make 3 phone calls. The scanner at the ICU entrance beeped red at 9:27 p.m. Access denied. Brooke had tried to check on the SEAL during her shift handoff, and the system had rejected her. Her badge. Her credentials. Her right to be in the room with the patient she'd brought back from the edge of death. A security guard named Marcus Chen, Patricia's nephew, someone Brooke had helped study for his nursing prerequisites 2 years ago, looked at the floor when she approached him. "I'm sorry," he whispered. "I can't let you through." The SEAL had been reassigned to Caldwell's personal care team. 3 nurses. None of them had been in the trauma bay. None of them had seen what Brooke had seen or done what Brooke had done. They would manage the post-surgical care following Caldwell's orders. Caldwell would write the surgery notes. Caldwell would document the procedure. Caldwell would control the narrative, the timeline, the explanation of how a critically injured Navy SEAL had somehow survived a thoracotomy performed by someone whose hand shouldn't have known how to perform a thoracotomy. The hospital administrator, Margaret Thorne, had scheduled a meeting for 10:33 p.m. Credential suspension hearing. Termination pending investigation. The email had been circulated to every department head: "We have a patient safety incident that requires immediate institutional response." Brooke returned her scrubs to the hospital laundry at 9:52 p.m. She folded the blue fabric carefully, folded it the way soldiers folded flags. Folded it the way people folded things they weren't going to wear again. The smell of antiseptic and blood clung to her hands. The feeling of ribs cracking, of blood against her palms, of a heartbeat reorganizing itself under her fingers, that feeling lived in her muscles now, another scar, another thing they couldn't erase no matter how hard they tried. She walked toward the administrator's office knowing that in 48 minutes she would be a civilian again. A ghost being erased twice. Once by the Pentagon. Once by the hospital that had just watched her save a life and decided that saving a life was somehow worse than losing one. The meeting room was waiting. The paperwork was waiting. Dr. Caldwell had done his work with surgical precision, and now there was nothing left but the signature that would end her career, the second time she'd been made to disappear. Dr. Caldwell stood at the trauma bay entrance, his face a study in cold fury as he watched Brooke's hands move through the patient's chest cavity with surgical precision. Her fingers worked the bleeder clamps with the fluid economy of someone who'd done this in field hospitals under fire, and Caldwell's jaw tightened, not with admiration, but with the kind of rage that comes from watching your authority unmade in front of residents. He turned away before she finished closing, pulling his phone from his coat pocket before he'd even cleared the double doors. His voice was a blade when the hospital administrator picked up on the third ring. Director Walsh. Dr. Marcus Caldwell. We have an emergency credentialing violation at Seattle General. Unauthorized surgical procedure. Scope of practice violation. I need this documented immediately. Caldwell's words moved like chess pieces, each one positioned, each one calculated. He wasn't shouting. That was the terrifying part. He spoke with the precision of a man weaponizing the system itself. She performed an emergency thoracotomy. No attending supervision. No board approval. High risk, potential liability. He listened for 3 seconds. Yes, I have witnesses. Yes, I'll file the formal complaint. He hung up and made another call, this one to his brother-in-law on the hospital board. Then another to the risk management director. Then another. Within 40 minutes, his voice had echoed through administrative channels like a stone dropped into still water, ripples spreading outward, unstoppable. By 10:15 p.m., Brooke was pulled from the floor by security, not aggressively, but the message was unmistakable. A nurse escort, a quiet ride in the service elevator, a walk down a corridor where she'd trained for 2 years and was suddenly being erased. The emergency complaint was already in the system. Caldwell had filed it with breathtaking speed, citing 3 separate protocol violations, performing a thoracotomy without credentialing, operating on a patient without informed consent, and exceeding her scope of practice as a registered nurse. The language was clinical, airtight, and devastating. By the time she reached the 4th floor, her credentials were flagged in the system. By the time she sat down across from Director Walsh in his office, the investigation was official. You saved his life, Walsh said, sliding the termination paperwork across his desk. His voice carried genuine conflict. But you violated every protocol we have. Dr. Caldwell has documented 18 months of insubordination. Policy violations. Scope creep. The board has reviewed his recommendations and they've decided we have no choice. Brooke's hands didn't shake as she reached for the pen. She thought of Sanjin. Thought of the 47 soldiers she'd saved, the Medal of Valor buried in a classified file that no one would ever read, that officially didn't exist. She signed her name in careful letters. Brooke M. Sullivan. The lem stood for nothing anymore. The signature was the final stroke of the eraser. By 11:15 p.m., she was alone in the hospital laundry room beneath the main floors, fluorescent lights buzzing overhead with the sound of industrial washers cycling through their final rinse. The basement smelled like detergent and steam and something chemical that masked blood. Her scrubs, the blue one she'd worn for 2 years, soft from 100 washings, were folded in front of her with precision. Each crease aligned perfectly. She smoothed the fabric with hands that had once held a Medal of Valor, hands that had held life and death in Sanjin valleys, now folding cotton like a ritual goodbye. The patch was still there, sewn inside the jacket lining. She could feel it against her ribs through 2 layers of fabric. Her fingers traced its outline once, the faded SEAL Team 3 emblem, the only proof that Major Brooke Sullivan had ever existed outside a classified file locked behind 3 security clearances. She placed the folded scrubs in the return bin, set her hospital badge on top, and watched a laundry worker, someone she'd never met, someone who didn't know her name, take the pile without looking up. The patch stayed sewn inside her jacket. The only thing she was walking out with was the only thing she'd ever had, the evidence they'd failed to erase completely. She moved toward the exit, her footsteps echoing on tile, the automatic doors sliding open to reveal a hallway leading to the parking lot where rain had begun to fall. The second ghost was being erased, just as cleanly as the first. 3 floors above, at 11:28 p.m., the Navy SEAL's eyes fluttered open in ICU Bay 4. His consciousness returned slowly, the way it always does after deep anesthesia, a gradual surfacing through layers of medicated fog. Dr. Caldwell stood at the bedside with 2 residents, pointing to the fresh surgical incision on the patient's chest with the casual authority of a man claiming credit. The unauthorized intervention saved his life, Caldwell was saying, his tone carrying the strange mixture of clinical assessment and thinly veiled resentment that always surfaced when he couldn't control a narrative. A registered nurse performed a procedure well outside her scope. Technically, she may have committed assault on this patient, despite the outcome. The residents shifted uncomfortably. One of them had watched the procedure. He knew what he'd seen. The SEAL's hand moved to his chest, feeling the thick bandaging, the sutures underneath. His eyes focused on Caldwell's face, the smugness there, the twisted logic of a man reframing an act of heroism as a liability. The SEAL's mouth was dry from the intubation. His voice came out raw and quiet. "Reaper." Caldwell turned. "What?" The SEAL's hand tightened on his chest. "Reaper. Where's Reaper?" His heart monitor began climbing, 75 BPM, 82, 89. Caldwell leaned closer, confusion flickering across his features like a man trying to understand a language he'd never learned. "Sir, you need rest," the SEAL's voice climbed, pushing against the pain in his chest, against the sedative still moving through his bloodstream. "Get me Reaper. Major Sullivan. Now." His hand pointed toward the door. "Get her now." A nurse moved to calm him, but the SEAL's eyes were locked on something beyond the room, beyond the present moment, locked on the memory of a figure in Sanjin dust moving toward him with a combat knife and hands that didn't shake. The monitor's beeping accelerated into a rhythm that made everyone move faster. At 11:28 p.m., at the exact moment the SEAL spoke his commanding officer's name, Brooke was standing at the ground floor elevator bay, her jacket folded over her arm, when the automatic doors of the main entrance hissed open and Commander James Harding walked through with the bearing of a man who'd just received a panic call from one of his operators. He was in civilian clothes, jeans and a charcoal jacket, but military hung on him like a uniform anyway. His presence made the air pressure change, the way certain people carry their authority in the space around them rather than in words. He rounded the corner toward ICU and stopped. Time moved differently for a moment. Brooke was there, standing by the elevator in street clothes, holding her jacket, looking like a ghost already halfway through disappearing. Harding's face went pale. Not afraid. Pale. The kind of recognition that hits like a physical force. He stood at attention, actually at attention, spine straight, shoulders back, the kind of formal respect you don't show to civilians. Major Sullivan. It wasn't a question. It was a salute delivered in 2 words. The hallway froze. Nurses paused at their stations. Dr. Caldwell emerged from the ICU bay, his confusion flickering into something uglier as he processed what he was hearing. Major. The word hung in the air like smoke. Brooke met the commander's eyes, and something passed between them that transcended rank, recognition of shared sacrifice, the wordless respect of warriors who'd seen the worst and still stood. Her voice dropped an octave, the deferential nurse's tone completely gone. "Commander Harding. Stand easy." The authority in her words made Caldwell take a visible step backward. He didn't understand what was happening, but his animal instinct recognized the predator in the room, and it wasn't him. The SEAL's wife, Karen, emerged from the ICU waiting area with their 17-year-old daughter, Emma. The girl had heard the exchange and was already typing on her phone, her fingers flying across the screen with the urgency of someone who'd just realized she was standing next to a classified file made flesh. "Pull her personnel file," Emma whispered urgently to Rita Espinosa, the unit charge nurse, the same Rita who'd taken her breaks in a separate room when Brooke sat down. "The real one," she said. "Major. That's military." Rita's hands trembled as she accessed the classified personnel database, the kind of record that required 3 separate security clearances that most nurses never even knew existed. She read silently for 5 seconds, her face draining of color like someone watching blood exit a severed artery. Her voice was barely steady. Silver star. Pause. 2 bronze stars with Valor. Another pause. Navy Cross nomination pending. The words came out barely above a whisper. Commander Harding's voice cut through the silence like a blade. Loud enough for the entire ICU wing to hear. Loud enough that a family 3 rooms down stopped mid-conversation. Major Brooke Sullivan served 18 months embedded with SEAL Team 3 as combat surgical officer in Sanjin, Afghanistan. Gasps rippled through the gathered staff. Dr. Ewan, the ER attending who'd frozen during the SEAL's coding, covered his mouth with both hands. A resident who'd watched Caldwell publicly question Brooke's competence at the nurse's station began crying quietly, turning away. Emma gripped her mother's hand so tightly Karen gasped. Rita continued reading from the file, her voice finding strength as the magnitude of what she was reading became real. 47 field surgeries performed under enemy fire. Each word landed like a hammer strike. Highest save rate in naval special warfare history. Jennifer Park, the nurse from the break room, the one who'd made a point of leaving whenever Brooke sat down, sank into a nearby chair and buried her face in her hands. The silence was so thick you could have operated in it. Caldwell's mouth opened. No sound came out. Commander Harding pointed to his own chest. August 2019, Sanjin Province. She performed a field thoracotomy with a combat knife while pinned down by enemy fire. His hand pressed against his ribs. She saved my life. This incision. He gestured toward the ICU bay. Same hands. Same blade instinct. Same decision made in 3 seconds that meant I got to come home to my wife, that I got to see my kids graduate high school. Karen stepped forward, her eyes locked on Brooke. You saved my husband the same way tonight. The same way you saved soldiers. It wasn't a question. Brooke nodded once. One movement. One acknowledgement that carried 18 months of invisible weight. Rita's voice dropped as she read the final section of the file, her words coming out fractured. October 2020. Black Ops Extraction, Operation Silent Angel. Mission classified. Record sealed. Personnel involved ordered to disappear under witness protection protocols. She looked up from the screen, her eyes meeting Brooke's. Official status does not exist. The hallway held its breath. Monitors beeped. Ventilators wheezed their mechanical rhythm. Fluorescent lights buzzed overhead like they were counting down to something. Caldwell's face had gone from smug to ash gray, the color of a man watching his world realign in real time. Commander Harding's voice was quiet now, but quieter somehow carried more weight. Major Sullivan was ordered by Naval Intelligence to maintain deep cover. No contact with former units. No acknowledgement of service. She gave up her identity. Her decorations. Her career. All to protect an operation that saved 40 American lives. He turned directly to Caldwell. And you tried to destroy her for saving one more. The silence that followed wasn't empty. It was the silence of people understanding, all at once, that they'd been measuring something immeasurable with a ruler. The quietest person in the room had been holding it all together the entire time. The SEAL's eyes opened like a man surfacing from deep water. His chest rose. Fell. Rose again. The ventilator wheezed its mechanical rhythm beside him, but his breathing had synchronized with the machine, a good sign, a living sign. Monitors beeped their steady chorus. Sinus rhythm. Perfect, beautiful sinus rhythm. The entire ICU team had gathered without being called. Dr. Ewan, the residents, 2 nurses with charts, the respiratory therapist checking tube placement. They stood in a semicircle around his bed, waiting for something they couldn't name. His eyes moved across their faces. Searching. Then his gaze fixed on the hallway beyond the glass partition, locked on something they couldn't see. His mouth opened. His voice came out raw, cracked from 18 hours of sedation and intubation, but unmistakable. A single word. Reaper. The room didn't move. Didn't breathe. One of the residents actually looked at the chart to confirm they had the right patient. Reaper wasn't a name. It was a call sign. It was the kind of name that appeared in classified briefings, in 1,000-page redacted case files, in conversations conducted on secure phones in soundproof rooms. The attending pushed closer. "You're safe now, son. You're in Seattle General Hospital." The SEAL's eyes didn't leave the hallway. "Reaper. Need Reaper." His vitals spiked, heart rate climbing from 78 to 94, pressure rising, the kinds of vital signs that meant acute distress, meant this patient knew something they didn't. "Who is Reaper?" Dr. Ewan asked, but the SEAL had already closed his eyes again, his body recognizing it had demanded something impossible and surrendering back into recovery. The team exchanged glances. Nobody answered. Nobody had an answer to give. But that wasn't the worst part. The worst part was that one person in the hospital could answer. One person knew exactly what that call sign meant, who carried it, what kind of surgeries that nickname had earned. And she was in the administrator's office 2 floors down, signing away her career while the man who destroyed it reorganized his lunch break. 37 minutes later, the SEAL Team 3 commander arrived. Commander Daniel Holloway, 5'11", shoulders like a linebacker, eyes the color of granite in winter. He'd been flying for 14 hours straight from San Diego, helicopter to airfield to helicopter again, because when a SEAL wakes up asking for a ghost, you move. Naval Special Warfare doesn't question. It acts. He came through the main entrance with 2 other operators flanking him, all 3 in dress uniforms, all 3 moving through the hospital lobby like they were checking an enemy compound. The security desk tried to slow them down. Holloway didn't break stride. "SEAL Team 3. Where's your SEAL patient?" The receptionist pointed upstairs. She didn't ask for credentials. Something in the way these men moved made credentials irrelevant. He found Brooke in the hallway outside ICU, standing alone, still in her scrubs, still processing what the hospital had just done to her. Her credentials were suspended. Her employment was terminated. Her notice of separation had been filed with HR just 20 minutes earlier, her name already being removed from the schedule system. She'd been walking toward the elevator, toward the parking garage, toward the exit that would take her away from this place forever, when she heard boots on tile. 1, 2, 3, 4. Military precision. Military purpose. She didn't turn around, didn't need to. She already knew. The way the hallway noise stopped. The way people unconsciously moved aside. The way the air pressure changed. Commander Holloway saw her face and went pale. Not shock. Not surprise. Recognition. The kind of recognition that means you just looked at someone you thought was dead, or disappeared, or buried so deep in the classified archives that seeing them standing in hospital corridors in nursing scrubs felt like looking at a ghost. He stopped 3 feet away from her. Didn't salute. Didn't even acknowledge her with words. His hand went to his chest. A fist. The old salute. The sign of respect between operators who'd held each other's lives in their hands. Brooke's eyes closed. When they opened, her entire bearing had shifted. The deferential posture was gone. The submissive tilt of her head was gone. She stood like a woman who'd been carrying a 100-pound weight and had just set it down. She returned the salute. Fist to chest. 1 beat. 2. Major Sullivan, Holloway said. His voice carried down the hallway like a low-frequency transmission. Not a question. A declaration. The SEAL's teenage daughter heard it from inside the ICU. Emma Torres, 16, had been sitting in the corner chair since her father was admitted, hadn't left except to use the bathroom, hadn't eaten more than the granola bar her mother bought her. She heard that name and her entire spine straightened. Her mother, sitting beside the SEAL's bed, heard it too and turned to look at her husband, as if he might suddenly explain why a military commander was announcing the name of a major in the middle of the hallway. The SEAL's wife stood and moved toward the glass partition just as Commander Holloway was crossing the threshold into the ICU. "Major Sullivan just saved your husband's life," he said. Not looking at them. Looking only at Brooke as she followed him inside. "She performed an emergency thoracotomy in the trauma bay. She's the reason you still have a husband." The room went so quiet you could hear the fluorescent lights hum their electronic pulse. Emma's mother, Sarah Torres, looked at the quiet nurse, the one in the corner, the one who'd been invisible the entire time, the one who'd smiled gently when she'd asked for a blanket. That nurse. The nurse who'd just saved her husband's life. The nurse Dr. Caldwell had been trying to fire was standing in front of them with a military commander calling her major. One of the ICU nurses, Jennifer Park, was pulling files from the secure terminal. Not the regular personnel file. Not the visible one. The classified file. The one that required 3 separate military clearance validations just to open. Her hands trembled as she read. The text on the screen moved like it was being transmitted from another dimension. Silver star. Bronze star. Bronze star with Valor. 2 purple hearts from wounds sustained in Helmand Province. 18 months of embedded service with SEAL Team 3, Charlie Platoon. Combat Surgical Officer. The citation for one of the Bronze Stars read, "For extraordinary heroism in combat operations near the village of Sanjin, conducting multiple field procedures under sustained enemy fire while maintaining composure and medical excellence in conditions that would break conventional military personnel. 47 field surgeries." Jennifer's breath came in shallow pulls. The woman whose shift was ending, whose employment was terminated, whose career had been destroyed by a man sitting in a conference room downstairs, this woman had saved 47 lives under conditions Jennifer couldn't imagine. This quiet nurse had seen things that would fundamentally alter how you understood the word courage. Commander Holloway stood at attention. His posture shifted into something ceremonial, something solemn, something that belongs to a different world than hospital fluorescents and heart monitors. His voice carried beyond the ICU, down the corridor, across the nursing station where doctors and residents were stopping their work to listen. His words were loud enough for the entire wing to hear. For Dr. Caldwell to hear, if he happened to walk past in the next 30 seconds. Major Sullivan performed 47 field surgeries under enemy fire in Sanjin Valley. She has the highest save rate in naval special warfare history. She carried SEAL Team 3 through hell and back. He paused. The silence was a thing with weight. And she just saved Petty Officer First Class David Torres with the same hands that held her wounded brothers together in a war zone. Downstairs, in a conference room on the 2nd floor, Dr. Marcus Caldwell had just finished his morning coffee and was reviewing his calendar when his phone buzzed. A text from someone in risk management. "Get back to Portland, General. Now." He didn't understand at first. Then he understood enough to feel the floor shift. Then his phone rang. NCIS. Naval Criminal Investigative Service. They wanted to schedule an interview regarding the complaint he'd filed against Major Sullivan. The surgery. The protocol violation. The procedural documentation. They wanted to review his patient records from the past 18 months. All of them. His hand started shaking. Not from fear. From the exact moment he understood that the weapon he'd constructed so carefully, the way he'd documented every fabricated violation, the way he'd built his case on altered patient records and backdated notes, all of it was about to be turned around. The investigation had started the moment David Torres whispered a name that meant something to people who don't exist on official rosters. The Naval Criminal Investigative Service doesn't investigate bar fights or administrative complaints. NCIS investigates crimes. When a decorated operator wakes up asking for a ghost and that ghost turns out to be real, when that ghost turns out to be buried under someone's deliberate sabotage, when records are falsified and a military officer's career has been erased, that's not an administrative issue. That's a crime. That's multiple crimes. Agent Sarah Voss arrived at Seattle General with 2 partners and a warrant that made the hospital's legal department go pale. "We need all surgical records for Dr. Marcus Caldwell from the past 18 months. Every case. Every complication. Every notation. The risk management director personally delivered the files. His hand shook as he handed them over. He already knew. Every administrator in the hospital already knew. The pattern was there if you looked, and now, with a warrant and federal investigators, everyone was looking. 36 hours of forensic document analysis revealed what Brooke had suspected for 18 months but could never prove. 3 patients had died under Dr. Caldwell's care. A retired Army major who'd suffered a nicked artery during a routine vascular surgery. A construction worker who'd bled out from a missed ligature in her abdomen. A veteran, James Corrigan, age 54, who'd coded on the table and never made it back. All 3 deaths had been documented as complications arising from poor post-operative nursing care. All 3 records had been altered. Post-op notes rewritten. Timelines shifted. One of the casualty forms blamed failure to maintain adequate monitoring, and the nurse's name on that shift? Brooke Sullivan. Dr. Caldwell had methodically fabricated evidence of her incompetence while burying evidence of his own surgical errors. The very weapon he'd used against her, the falsified documentation, the performance reviews constructed on lies, the orchestrated assault on her credibility, was now the blade that cut him down. At 2:30 in the afternoon, in a conference room with the hospital's board of directors, the medical director, and 2 federal investigators, Dr. Caldwell sat across from his own reckoning. Medical Director Huang opened a folder and slid it across the table with the kind of precision that means this conversation is over before it begins. 3 patients died because you prioritized your reputation over their care. Huang's voice was ice and authority. You falsified records. You destroyed a decorated combat surgeon's career to protect yourself. Caldwell tried. He actually tried to deflect, to reconstruct his narrative, to explain why his documentation was necessary, why Brooke had really been the problem. She violated protocol, he started. Huang cut him off. She saved a man's life using skills she earned in a war zone while you were worried about hierarchy. The director's eyes were the color of flint. Your medical license is suspended effective immediately. Criminal investigation pending. Your attorney should contact us regarding civil litigation. You're terminated. By evening, every staff member at Seattle General knew. The all-staff email went out at 5:45 p.m. Dr. Marcus Caldwell's employment has been terminated for cause pending investigation into documentation irregularities and post-operative complications. The sanitized language couldn't hide what everyone now understood. Jennifer Park threw up in the bathroom. Dr. Yuan, who'd witnessed the thoracotomy and understood exactly what Brooke had done, found himself smiling in a way that felt dangerous. He printed Caldwell's mugshot, taken 2 hours earlier after federal agents escorted him to Portland Police, and posted it on the doctor's lounge bulletin board with a single handwritten word, karma. 3 families filed wrongful death lawsuits before the night was through. Caldwell's brother-in-law resigned from the hospital board within hours. The medical examiner's office opened reviews of 2 of the 3 deaths. Federal charges were being prepared, falsifying medical records, obstruction of justice, and reckless endangerment. The quiet nurse, the one who'd been invisible, became the only thing anyone could see. And Brooke Sullivan stopped hiding. If you're enjoying the story so far, hit that like button. And I'd love to know, drop a comment telling us where you're watching from.